So in this video, we're going to talk about adrenergic receptor. Okay. So there are two types of adrenergic receptors: is alpha receptor and the beta receptor. And again, alpha receptor is divided into two types: is alpha 1 receptor and alpha 2 receptor, and beta receptor is of two types: beta 1 receptor and beta 2 receptor. Okay, so we can say that alpha 1 and beta 1 receptors are the stimulatory receptor, and alpha 2 and beta 2 are the inhibitor receptors. Yeah. Alpha and beta both are G protein coupled receptors. Among them, alpha 1 is GS, alpha 2 is GI, and beta 1 and beta 2 are the GS receptor. So, sorry, alpha 1 is GQ receptor, alpha 2 is GI receptor, beta 1 and beta 2 is GS receptor. Okay, so what is really this GQ, GI, and GS? What are and how they really function? So let's talk about it. First, GQ receptor. So let's assume that it's a membrane, and this is the G protein coupled receptor. It's a serpentine receptor. So this is GQ and it's alpha 1 receptor. So when alpha 1 agonist bind with this receptor, then this receptor gets activated and it activates phospholipase C. Okay. So what phospholipase C does is it breaks down phosphatidyl inositol 4,5 diphosphate into inositol triphosphate and diacylglycerol. Okay. Inositol triphosphate release calcium from the sarcoplasmic reticulum, which activates calcium dependent protein kinase C. And diacylglycerol activates protein kinase C. And this protein kinase C give the biological effects, like it can do muscle contractions, it can activate enzymes, so they do the biological effects. Okay, let's see what GI do. So this is the alpha 2 receptor, and when alpha 2 agonist bind with this receptor, it decreases the adenylyl cyclase or inactivates the adenylyl cyclase. So decrease the production of cyclic AMP, and that decrease the phosphorylation of the enzyme, enzymes. So enzymes got deactivated or inactivated, so no biological effect is produced. Okay. And now let's talk about GS. This is the beta receptor, beta 1 or it can be beta 2. When the beta agonist bind with this receptor, it activates adenylyl cyclase that increase the production of cyclic AMP from the ATP, and it increases the phosphorylation of enzyme and that causes the enzyme activation and it produces biological effect. Okay. Now let's talk about where these receptors are located. Okay. When our sympathetic system gets activated, so some tissues or organs get stimulated and some are inhibited, right? Okay, so all the organs to be stimulated have alpha 1 receptor except heart, juxtaglomerular apparatus, and third is adipocyte. Okay, so they have this beta 1 receptor. Okay, and all the tissues to be inhibited have beta 2 receptor except presynaptic nerve terminal, platelet, and adipocyte. Okay. So let's see what happens when our sympathetic system get stimulated. Okay. So let's assume that you are running from a dog, okay, and the dog is running after you. So at this time our sympathetic system gets activated to save your life. Okay, so in this moment what will happen? So when we're in danger, okay, so your body's defense mechanism will get activated. Okay, so erector pili muscle, if you say that erector pili, what will happen to erector pili muscle? It's got contracted so that your you get the goosebumps or you get the like yeah, uh, your skin hairs get straighten up. Okay, so which receptor should be in the erector pili muscle? Obviously alpha 1 receptor. It's is the stimulatory receptor, right? Okay, so let's see what about the eyes. Okay, when uh, I talk about the eyes, okay, so there is two types of muscles in the eye. There is dilator pupillae, and there is constrictor pupillae. Okay, so this dilator pupillae is supplied by sympathetic nervous system, sympathetic system. Okay, and it has this alpha 1 receptor. So when sympathetic system gets activated, this dilator pupillae is contracted. Okay, it contracts, and when it contracts, okay, then this people when it contracts, then this people gets larger. Okay, so that more amount of light can enter through these people, and and you can have a clear vision, right? Okay, which is needed for you to run. Okay, then there is also something called ciliary muscle in the eye. Okay, which has beta 2 receptor. Okay, so let's see if I can draw a picture of eyeball. Okay, though it's okay. So this is the ciliary muscle. And this is the suspensory ligament, and this is the lens. Okay, this is the suspensory ligament, and this is the lens. Okay, when this ciliary muscle gets relaxed, because it has beta 2 receptor, it gets relaxed. So when this ciliary muscle gets inhibited and it gets relaxed, this suspensory ligaments gets tightened. Okay, the suspensory ligaments gets tightened. So when the suspensory ligaments gets tightened, this lens becomes flattened. Okay, and when this lens becomes flattened, you can have a distant vision. Okay, so uh, you need this distant vision to save your life, right? You should look to where should you go, in which path this dog will not follow you. Okay, so it causes you to save your life and have a distant vision. Okay, so let's see what happens to the gastrointestinal tract, or GIT. So in this moment, I don't need to digest my food, I don't need to absorb my food, and I don't need to defecate, right? So the sphincters of the gastrointestinal tract should be closed, and it should have alpha 1 receptor to constrict the sphincters. Okay, what about the smooth muscles? Okay, so smooth muscles should be inhibited because we don't need this GI contraction at this moment. So beta 2 receptor should be there. And what about the blood vessels of GIT? So we don't need to absorb food right now. So it should constrict the blood vessels, and we have alpha 1 receptor. What about lungs? Okay. At this moment, your tissues need more and more oxygen, and you uh, need to breathe more and more air into your lung to get more oxygen. So we need bronchodilation. Bronchodilation. So we have beta 2 receptors in our bronchioles that dilates the bronchioles. Okay. What about the heart? So in the heart, I've talked that it has beta 1 receptor. Okay. So there is the SA node, there is AV node, there is the atrial muscle, and ventricular muscle. So in SA node, what happens is increase in heart rate. So it's called positive chronotropic effect. AV conduction increases the velocity of conduction velocity. The AV conduction velocity increases. So positive chronotropic effect. And atrial muscles and ventricular muscles increase the force of contraction. So this is called a positive inotropic effect. Okay. Let's talk about the blood supply to the whole body, or blood vessels of the whole body. So in GI tract, these blood vessels gets constricted because we don't need to absorb foods right now. In GI tract, it's constricted. In renal tract or renal system, the blood vessels constricted because we don't need to urinate right now. Okay, we don't need to make urine right now. So more or less everywhere the blood vessels gets constricted, except in the skeletal muscle, where in these muscles blood vessel we have the beta 2 receptor which dilates the blood vessels. But there is no change in the blood vessels of central nervous system and the cardiovascular system or coronary blood vessels. Coronary blood vessels, they do not dilate or constrict. Okay. So let's talk about the metabolic changes. Okay. What happens in liver is there is this beta 2 adrenergic receptor, and it decreases the gluconeogenesis and it decreases the glycolysis. What about adipocyte? So there is a special receptor in the adipocyte. It's called beta 3 receptor. It's a modified type of beta 1 receptor. What it does is increases the free fatty acid level in blood. So it increases the free fatty acid release from the adipocyte to the blood, It increases the gluconeogenesis. Okay. What about the skeletal muscle? Okay. Increases the sodium potassium ATPase. Increases the potassium uptake into the skeletal muscle. And we have this beta 2 receptor in this muscle spindle, and so that it causes tremor in the skeletal muscles. We have this beta 2 receptor and it causes tremor. Okay. Let's see what happens to the uterus when we're going to talk about non-pregnant uterus. But so uh, in non-pregnant uterus, uh, there is more alpha 1 receptor, so it facilitates or increase the chance of pregnancy, because when the uterus contracts, it facilitates the movement of sperm through it, so that it increases the chance of pregnancy. In pregnant uterus, we have more beta 2 receptor that relaxes the uterus and decrease the chance of premature labor. And in the urinary bladder, there are two things like detrusor muscle and the sphincter. So we don't need to urinate right now. So we have this alpha 1 receptor in the sphincter and it gets constricted. Okay. In detrusor muscle, so we have to retain the urine. Okay. So it has beta 2 receptor, it relaxes and retain the urine. In male genital tract, there is two things in the main genitalia, is erection and ejaculation. Erection is maintained by parasympathetic nervous system, and ejaculation is done by the sympathetic nervous system. Okay, so there is that alpha 1 receptor in the seminal vesicles that that helps in constriction of the seminal vesicle and ejaculate the semen. Okay, and just a glomerular apparatus. Okay, what about it? It has the beta 1 receptor and it releases renin. So that's all for this video, and we will talk about the autonomic pharmacology in later videos. Okay.